afternoon. I am Bridget Hartnett. I am a partner here at Sobel Co., and I'm very happy you could all join us today for our quarterly webinar. I hope everybody survived the snow and are digging out, and for those of you who are winter people, I hope you enjoyed it, got out, play with the kids or whoever, and built a few snowmen. So we have a great speaker for you today. I don't want to waste too much of your time, but I did just wanted to mention a few things before we get started. If you do have questions, you'll see in the upper right-hand corner there is a Q&A section. Please put your questions in the box, monitor them throughout, and then we will leave some time at the end to hopefully get through all of your questions. Also, for those of you who have joined us previously on our webinars, you know that during the presentation, we randomly will launch polling questions. So today we have 4 questions for the group. And if you're looking for CPE credit, you'll need to enter a minimum of 65% or 3 questions. But if you don't need CPE, we still encourage you to answer them, just to give Jonathan and his a little bit of feedback as we go. And I think before we actually introduce Jonathan, I'm going to actually ask Colleen to launch our first poll just to get it out of the way. So the first polling question we have is, has COVID-19 significantly impacted your organization's ability to fundraising, unemployment, cash flow, volunteerism, all of the above, or none of the above? We will see the results. I have to imagine that most people and most organizations have been impacted some way. And Colleen, can you see the results? I'm not seeing those results at all. So I would have to imagine that most organizations have been impacted, probably, if I had to guess, all of the above in some way or some form. So we'll actually at some point get those results for you, but I don't want to hold anybody up, so I will move on with the program. So
Bridget, you were correct. All of the above is 38%.
All right, so there we go. I'd be very surprised if we had any that were none of the above.
You have 50% none of the above.
All right. Well, now it is my pleasure to introduce our speaker for today. So Jonathan Pearson is Director of Corporate Social Responsibility and the Executive Director of the Horizon Foundation for New Jersey. Horizon Blue Cross Blue Shield of New Jersey is recognized as an innovative and leading corporate citizen that serves over 3.5 million members. John continuously collaborates with senior leaders and other internal colleagues to foster relationship, participation, and input to guide the foundation in corporate responsibility strategy. He is responsible for developing partnerships with nonprofits and community-based organizations that closely align with the foundation's business and community interests. He collaborates with organizations and provider partners to co-invest in programs that address emerging health issues and social determinants of health, use, oral health, obesity, and diabetes prevention. He informs and builds strong relationships with key opinion leaders and other stakeholders to demonstrate how the foundation is improving the quality of life for members and all residents. He promotes employee engagement through volunteerism and service projects to increase company loyalty, drive employee participation, and support local communities throughout the state. John also executes a communication strategy that broadly disseminates grantee impact stories that highlight the foundation's commitment to serving members and transforming healthcare in New Jersey. He generates positive media coverage through traditional, digital, and social channels to enhance the foundation's reputation and protect the brand. He often serves as company spokesperson and representative within the philanthropic community throughout New Jersey. He currently serves on the board of the Council of New Jersey Grantmakers, the Salvation Army of New Jersey, and Rutgers University, New Jersey Institute for Food, Health, and Nutrition. He earned his bachelor's degree from King University and his master's from the University of Notre Dame. And he currently resides in Union County with his wife and his 3 sons. So with that, I will turn it over to John.
Hey, Bridget, thank you so much for that introduction. I hope everyone can hear me. And I hope everyone had a chance to dig out with this storm. I know in talking to my team, they live all over the state. And up here in Union County, it got about 2 feet and it took about almost 2 days to dig out. So hopefully everyone's doing well. I want to thank Sobel and for this great conference. They're a terrific, well-respected organization. Bridget, thank you for the introduction again. And I would be remiss if I did not thank my good friend, Sally Glick. Now, one thing about Sally asked me to do this. She's like, hey, would you participate? But she's really not asking. When Sally reaches out to you, it's like, okay, I got to do this. So anyway, happy to be here. Good afternoon again, everyone. It's a great opportunity to talk a little bit about the Horizon Foundation. As Bridget covered, it's our philanthropic arm of the company. We are the largest and oldest health insurer in the state of New Jersey. We're about 90 years old, headquartered in Newark. The mission of the foundation is really simple. It's really to make New Jersey a healthier community, addressing health equity, healthcare disparities, and some of the programs that we fund around the state. I've had the pleasure of serving as the executive director since 2012, and I've been with the company now. It's my 26th year, which I started when I was about 10, and I have a department of 7 great professionals that really are terrific, and a lot of what we'll talk about today is really the effort of our entire team. Moving to the next slide here, as I mentioned, the foundation is our philanthropic unit of the company, if you will. We were founded in 2004, and you can see we're focusing on making sure we make strategic investments with nonprofit organizations that not only support those organizations, but align with our business and the needs of the community that we see. And those needs have changed dramatically since March of last year. And we're going to get into the COVID piece of it. But I really believe, and I want to say this, I think our foundation has been part of the fabric of New Jersey for the last 16 years, not only in the city of Newark, but around the state of New Jersey. I think we've become an important anchor organization. So a little bit about our strategy. When we look at our department, the foundation is a very big piece of it. We also have our community affairs activity and our employee engagement activities. Bridget was kind of describing our department, and really we want to refine our strategy every year. We want to cultivate mutually beneficial relationships with nonprofits, support our company's mission, our employees, and the communities that we serve. And here's again, at a very high level, the categories that we focus on in terms of our strategy and how we implement programming. I'm not going to drill down on this, but I just wanted everyone to understand it's in the context of these strategy categories in terms of how we execute. And a little bit on our governance structure, again, just to give you guys some insight. The foundation is governed by our bylaws and policies, similar to how you run your nonprofit organization. The board has complete oversight for everything we do, from operations to thought leadership to advance our mission. We have 4 board meetings a year, and the primary responsibilities of the board is to help us shape our strategy, build out our business plan, establish our areas of focus, etc. And you can see here, Gary St. Hilaire, he's the CEO of Horizon and also our board chair. So we have the senior leadership of the company that helps guide our foundation, and we have 3 external directors, which is atypical for a corporate foundation. And quite honestly, they add so much value to what we do day to day that I really think it's been terrific and beneficial for us to have the eyes and ears of 3 external folks join us on our board. So that's really the backdrop of Horizon and our structure. I wanted to, again, give some context before jumping in on our primary topic, which is COVID-19. We have a little bit of a case study we're happy to share with you here today. So you look at COVID-19, the impact in our response as a foundation, and really, quite honestly, as a company. I recall March 16th of 2020 was our last day in the office. And everyone was like, okay, we'll be back in a couple of weeks, which turned into not going back at all and not going back so far this year. We certainly had to pivot and adjust, and we were seeing the impact of COVID very early on in terms of its disruption and its clear disruption in the nonprofit sector. And personally, I'll just share, I was actually at a Rutgers basketball game March 7th with 8,500 people at the rack. Clearly, COVID was in the building at that time. And I just wish everyone on this call, your families are healthy and staying healthy as we kind of work through the situation with COVID. So I'm going to jump in and talk about, again, how we really responded to this. So when we took a step back in March, leading into our March 30th board meeting, as I mentioned, my team, we got together. We wanted to assess COVID, and we put together these 5 steps in building out our plan. We wanted to make sure that we were operating with a lot of flexibility, being very agile, talking to many nonprofits we support. We want to be collaborative and very flexible. And we understood that nonprofits had many challenges in front of them, from a sustained level of support to funding that they normally get from the government sector, private sector, foundations, individual donors. So these are the 5 steps of our plan and how we approached it. Part of our plan was an environmental scan, understanding what's going on in the environment. These are very updated statistics from the other day. I pulled them down from the Department of Health. So I think everyone kind of knows the case here. We have 112,000 vaccinations underway, which is terrific. The number of tests we've done. So New Jersey ranks at the top of the country in the number of cases, deaths from coronavirus. Not a place we want to be in terms of being at the highest end of this. And we also know in these numbers, there are social determinants of health and other health disparities that are contributing to these numbers, particularly in communities of color and also the senior population. So that's, again, a very high level, 30,000 feet in terms of COVID and the impact. When you start drilling down a little bit on impact on community, one of the big things that we're seeing and we're continuing to see is the unemployment rate hovers just around 8%. And you can see $20 billion in wage replacement benefits since COVID, which is astounding. And the White House is trying to put the stimulus package together and get that through, which is terrific. There's other programs here at the state level, but until we get this economy back, we're still going to be very much challenged. And then when you look at some of the other leading issues like food insecurity, you're seeing increases here in Newark by 50%. You're seeing increases all over the state. So we certainly have a lot of work to do here in New Jersey in terms of at the community level. When you look at the impact on nonprofits, another view, this is data that we polled and we worked closely with Linda Zippo and the Center for Nonprofits as she was doing these rapid surveys to get real-time information to understand, what's really going on with all of the nonprofits in New Jersey. And you can see here, 96% of nonprofits had an experience of a disruption. And that number may have gone up since the survey, but we really use the data to inform our strategy, inform our response, and really use it as a listening mechanism and as a feedback loop as we started plotting out, what we can do here in New Jersey related to our foundation. And we also we recognize the loss of revenue, the cash flow issues, the limited volunteer support. Those are all contributing factors within the nonprofit community. So as we kind of gathered the data from various sources, a big part of what we do is stakeholder engagement, and we want to make sure that we are communicating with all of our organizations that we support. We did that over 10 months since March 16th. We continue to do that. It's a significant focus of our team in terms of outreaching to grantees, maintaining dialogue, sharing information real time, and also reconfirming or reaffirming our commitment to their organization because of what I just said. They're losing revenue, they're losing their fundraising capability in some arenas. So we want it to be clear that we're going to stand with the organizations we support. And part of that is also, how do we engage our employees? And I'll talk a little bit more about that in my presentation, but having that engagement with stakeholders is critical to having a successful implementation of our plan. So regarding the plan, these are kind of the high-level steps. I mentioned several times already, it was really built on collaboration. It was built on being flexible. It was built on being adaptable and listening. We felt that we had to do all that front-end work before we can start implementing any type of grant making to address the immediate COVID-19 needs. And it was also important for us to look at how do we sustain organizations with a level of programmatic support. So some groups that we support, how do we continue? How do we sustain that level of support? How do we fund new opportunities? And then also allow organizations to shift their grant resources, right? So perfect example would be if we funded a kids oral health program as an example, and that organization is dealing with other challenges, we wanted that organization to know, hey, we can shift your dollars into another program and without penalty of adhering to those grant criteria that we set out. We also wanted to invite organizations in early to receive funding. I mentioned we have 4 board meetings a year. We have our budget plan, but we invited organizations in early. And again, it all starts and ends with maintaining a high touch in terms of how we talk to the leaders of the organization and the folks that we work with day to day. So the funding opportunities, we know that there were many places we could have landed related to funding and where we place our investments. But again, using the survey data that was collected by the Center of Nonprofits, looking at our typical funding areas around health, listening again to grantees, we developed these 6 key areas to direct our COVID-19 programs. And it starts with the emergency food distribution and it kind of ends with organizational capacity. We thought these areas, again, based on what we heard, what we read, and the data that played out from the center, we could have an impact within these 6 categories. So in terms of executing our grants, I mentioned we have a board of directors. So all of these plans, all of these strategies were presented. We had full board approval. We did have to tweak our plan. We had a number of internal colleagues that helped shape our plan. But when we finally executed our COVID grants, about $816,000 from our foundation was deployed for COVID-19 immediate programs based on the categories. What we had to do was really pivot and move resources around, because when we started our year in January, February, we had a different plan. So we had to re-engineer our budget and move some resources into our plan to get to this number. But this number is a little bit complex because it has a few different categories. You can see here we have a grants reallocation. And what we did, one of the first things we did is we went back to the fourth quarter of 2019, which is typically a very heavy board meeting, and we made about $1 million of grants, which really started January 1, 2020. And we went back to each organization and said, we know we funded this program and it was approved, but if you want to pivot out of that program and redirect your dollars or a percentage of that grant, we certainly want to be supportive and do that. And a number of organizations came through and actually reallocated. We also topped up grantees. And what I mean by that is organizations that we were funding for a certain program also had additional COVID-19 needs. So as an example, say a typical grant was $25,000 for this organization, we may have layered on top of that another 10, 15, 25,000, top them up to address COVID and also sustain their program that we normally would fund. And then we made new grants, grants to new organizations, not affiliated with 2019, not topping up, but new grants. And then the big piece of our giving is our employee matching gifts and our volunteerism. There was tens of thousands of dollars that were contributed by our employees for COVID. That's not really represented in the $816,000 number. But employees certainly were a big driver, not only of financial support, but also volunteers, and I'll cover that a little bit later. But those are kind of the top line, components of how we executed our grant making and still sustained as much as we could our normal grant making philosophy and programmatic support. And when you roll it all up, and what we have to do as a foundation team, we have to report back to our board. So this was a high-level dashboard that we put together. Again, the 816 was the number, 37 total grants just for COVID. Now, we made last year in and around 85 grants. So COVID was a big part of it, which included the 26 new or topping up and about 11 of the reallocated. So that's how we got to that number. You can also see on this document, grants were distributed in 12 counties. We tried to be as targeted with our intervention and grant making as possible. An example of that would be in Atlantic City, because of the casino closure and a heavy employee population that's really tied into casino business and the ancillary businesses that surround the casino. They had upwards of 30,000 people that were furloughed, and the biggest need there was food and food insecurity. So our grant was very targeted around food distribution in Atlantic City. And there's also other hotspots around the state where we tried to be laser focused. You can see here, our grant served about 196,000 individuals. This is all self-reported by nonprofits when they submit their grant proposal to us, but we reached a significant amount of individuals. And we delivered ongoing communication. And I talked about the stakeholder engagement. We had 21 communications that went out to our partners. Those are messages around the CARES Act, around the PPP program, state programs, and just providing education to many of these organizations that maybe we're not getting it or we're not getting it in a timely manner. We try to put out a communication at least once or twice a week, in addition to continuous, texting to leaders and nonprofits, emails, calls, Zoom calls, everything else. It was a huge effort for our team to make sure we had a very high touch. And in the middle of all this, we also launched with the Center for Effective Philanthropy a grantee perception survey. So that happened in the fall, which is going to give us another huge feedback loop in terms of how we perform as a corporate foundation. So very high touch. And again, our employees were a big driver. 120 employees volunteered at 11 events. They certainly, we certainly heard them loud and clear. They wanted to get involved. They wanted to participate. We had to do it safely. We found a partner that we can do this with. So the Community Food Bank of New Jersey, in 2 locations, one in North Jersey, one in South, we pulled off these events, and our employees executed this in terms of employee volunteer pay time off, and we're able to coordinate all these activities. So this is the top line report that we presented to our board. But again, I think, for us, significant impact in terms of, what we could do in contributing to addressing COVID-19. I'm going to pause there because I think we have to have one of these polling questions. So let's launch one more polling question, please.
So the second polling question is, in response to COVID-19, did your board leadership hold strategic planning meetings to address the short-term challenges, leverage resources from state's nonprofit experts, reduce services and programs, worked with professional service providers like your CPAs, or all of the above, or none of the above? And again, I think I'm just going to have to guess because for some reason, Colleen, I can't see the results popping up. So it's going to be like a little bit of a game here. Can I get the right answer? So I'm going to have to guess that most people are probably saying all of the above, but can you give us the results? No? All right. So, right. I'm not seeing the results pop up, so hopefully everybody else is. But we'll go ahead and go back to Jonathan.
Great.
The results are just coming in.
Okay, they're still coming in. All right, we'll give it another second.
And Jonathan, for some reason, you and Bridget can't have your mics on at the same time. There's too much feedback. So when you go to the Q&A portion, you're going to have to go back and forth, unfortunately. So as of the results, I would say 39% said A, and 35% said E, and 13% said none of the above.
All right. Okay, well, I know it's definitely been some trying times for those in leadership trying to navigate through all of this stuff. So let's go back and hear more from Jonathan and what they have been able to accomplish. Everything they've done so far has been amazing. So let's continue to hear.
Thank you, guys. So again, just drilling down a little bit more on employee participation. As I said, our employees are a big part of our philanthropy. We have a community engagement council internally made up of leaders that help drive all of our community programs. And you can see here some of the things that we did related to COVID around Giving Tuesday, around National Volunteer Week, et cetera. Virtual volunteering was a big area for us. We built out that capability for some of our employees that did not feel comfortable volunteering in person. So we've really expanded our scope, and I think really engaged our employees in a very significant way. And I think there's a lot of opportunity this year to enhance what we do. We call our program Horizon Cares, and all of our employee programs fit under Horizon Cares. And I just want to share a quote from Carlos Rodriguez, the CEO of the Community Food Bank of New Jersey. He basically said, in summary, Horizon was one of the first companies to step up. So we felt, that was part of our responsibility as a New Jersey-based company, and where we live. Our employees live in all of our communities in New Jersey, and all of our members are here as well. So I just wanted to share that from Carlos. In terms of employee feedback, we have a lot of feedback we ask for from employees. You can see some of the quotes here from various folks from various departments across the enterprise, some at the very senior level, some mid-level, some starting out with the company. So again, building that morale, building that engagement, it's really important as a corporation. Sobel, I'm sure you do the same thing. You want to retain and attract the best talent. And we see repeatedly in all of these studies by EY and Deloitte that employee engagement and having aligned values, the employees and the organizations that you work for, if the values are aligned, you're going to have a significant amount of loyalty that an employee displays, and also morale and longevity working for your organization. So I wanted to share this feedback. Thought it was really important for folks to see. And then from a communication perspective, that's something that we do every day. We try to really highlight our partners. We try to highlight and develop content and stories that are impactful, that we can broadly share, whether it's through our Horizon Health News communication channel, which is a big channel where we push out information not only about the foundation, but about the company. We certainly promote this on social media. And here's a tweet from the speaker Coughlin. When we put out information, we got this really nice bit of feedback from speaker, and that's also part of how we engage. We want to make sure that key influencers, policymakers, key opinion leaders, and you can see the other categories listed here. We want to make sure we're touching all stakeholders to help build our reputation and our trust within New Jersey. So communications is critical in terms of what we do, not only externally, but also internally. And then finally, kind of this wrap up, this story went out focusing on nonprofits, that were hit hard by COVID, and what was our response to it. So this was a year-end story about, what we did as a foundation, what we also did as a company. And I'll just share briefly, in addition to the $816,000 that we contributed and our employee population, the company also invested another $4.5 million, which a majority of that money went to purchase PPE for healthcare providers and hospitals. When there was a shortage in the state early on, we actually went out as a company and sourced those products, purchased them, and sent them to the governor's stockpile. And then we also contributed $2 million to the New Jersey Pandemic Fund. So I wanted to make sure that people understood it's just not about our foundation and our department, but the company really holistically, that was our investment in terms of our philanthropy. So, and also as important, not saving this for last, but the best for last, what our partners tell us. This is really critical. Our partners providing us with feedback. They're all key opinion leaders. They're all leaders in their community. And Bridget, you can see we have the Salvation Army the major bets here contributing to this. Bridget and I both are on the Salvation Army Advisory Board statewide. So this is as critical as any component of what we do, making sure that we, again, have that feedback loop. And I wanted to really close with this slide. So with that, that's my presentation, but I know I have a couple of questions that have come in, and I encourage other questions. I'm go to the questions first before the last polling question, I believe, Bridget. Is that?
Yeah, I think we're gonna do one polling question now because we have 2 left. So we're gonna see how this works. So did you identify any new funding sources? Grants, individual donors, other nonprofit organizations, corporate partners, all of the above, or none of the above? I'm really hoping we get a lot of all of the above on this one. But we will see. Oh, and I can actually see the results this time. So I don't get a guess. But yes, so it looks like, as you know, the answers are still coming in, but it looks like most everyone is, I'd say the majority at 44% right now is coming up. It's still shifting. So, all right, I think it looks like it's holding. I don't know, Colleen, if you want to go ahead and close it, but it looks like 44% said all of the above. So that's a good sign that there's a variety coming in. There is also at 22% is that they've gotten new grants. So hopefully some of those are from Horizon. So with that, I think we are now going to switch gears a little bit, and we're going to just take some questions. So if you've got other questions, please put them in the Q&A. So one of our questions that came in from Karen had to do with foundations or organizations that are not necessarily health-centric, but have health and wellness programs. So, you know, how the foundation is working with those programs or those organizations. I don't know if you want to take that one, Jonathan.
Yeah, no, absolutely. Great question, Karen. And, you know, we certainly do that. One example would be First Street Playhouse in New Brunswick. It's an arts organization, arts education, a number of other things that they do. But they also develop these touring musicals that travel around the state. And actually, this is our second production we've co-funded. We commissioned the Diabetes Prevention Initiative, and now we've commissioned an opioid prevention initiative, which is called Anytown. And Anytown is a story that describes how folks, particularly middle schoolers and high schoolers, can go down the path of addiction, starting with a prescription opioid. So through their artistic levers that they have in the beautiful way they tell story through these musicals in the impactful way, we co-funded that with Robert Wood Johnson Barnabas Health System. And this musical travels around the state to about 60 schools when we're in school to deliver these really important messages. So that's one example. And it's really not about if it's a health-centric organization. It's more about our priorities within our strategy. And if there's organizations that are addressing those priorities, we're certainly always open to listening and having a conversation. So I hope that helped, Karen.
Okay, thank you. So we had one other question come in from Margene. So when you were speaking about different ways of volunteering before in your presentation, question came in about what types of virtual volunteering were you seeing your employees kind of take place in, or that you're seeing out there?
Great question. So the virtual piece, we were a little bit behind because, again, as we're building our plan, January, February, we're getting ready for National Volunteer Week. We were going to launch a program with the American Cancer Society, which is kind of like an Uber system where patients that need to get transportation back and forth to their cancer treatments that did not have access, our employees were going to take this on as a signature program, which they would then participate in. So when COVID hit, that program was put on hold, as well as many others. Some of the things we did were around mentoring, some of the virtual volunteer opportunities. We also had some of our behavioral health team members, address some of the mental health or social isolation issues that were happening in parts of the state. But this is a capability that we need to build out further, and it will be part of our plan as we move forward. But those are just some examples of the virtual volunteering that we did.
That's great. One other question came in, just very specific, is do you fund grants to Somerset County nonprofits?
Yes. We skipped over Heather, though. Do you want to jump back to Heather, or do you want?
Yeah, I was going to jump back to Heather because I think it's going to kind of go in. I think her kind of question pretty much falls in line with some of the other questions we have, which, if we want to talk a little bit about how the foundation is starting to address the effects or the impact of COVID in 2021. So we talked a lot about, what your reaction was in 2020 and how you did that, but going forward, what do you see the impact in 2021?
So Lisa, real quickly, we love Somerset County. It's a great county. Certainly open to talking to nonprofits, and yeah, there's groups that we support in and around Somerset County, Henderson County. A lot of organizations that we support, their geography may cover 2, 3, 4, 5 counties programmatically. But a group called Community in Crisis is based in Somerset County. They're an opioid prevention organization. So that's just one example. But again, we're really focused on the alignment with our strategy, and we're open to talking to organizations to see how we can potentially collaborate, where there's a mutual beneficial relationship that we can start. So hopefully that helped. And Bridget, you want me to jump back to Heather, correct?
Yeah, I think, some of the questions, Heather's question and, some of the other questions we wanted to address was kind of very similar in the fact, what are the strategies long-term, and looking into 2021, what you kind of see coming down the road.
No, great question. We learned a lot last year. We certainly had to all pivot and rethink how we work with organizations. We had to be very agile in a very difficult environment. I mean, this is terrific, right? We're all on this webinar. We can, I can see Bridget. I can't see everyone. You can see me. This is clearly a barrier to executing in some respects, and it's also a positive in other respects. So I think everyone just really had to rethink and retool in terms of how they work in communities. And for us, we rely on data to really help inform our decision making. And the beautiful part about working at Horizon, for me and my team, we can go to our subject matter experts within the company to say, okay, what's going on around social determinants of health, and what are you seeing? Or going to our analytics team and getting really good reporting on diabetes care or mental health care, which again can inform our decision making. So we really had to be more proactive, understand how to use data. I think that was a big part for us, really embedding that into our work. And as we move forward, I think we're going to have more opportunities for collaboration. I think when we can collaborate and when we can partner, and I know that's something that's not new, but in this environment, you're seeing limited resources. You're seeing, the government sector with many challenges here in New Jersey. So collaboration, working together, working smarter where we can, I think are some of the lessons that we learned. And when you look at our funding priorities, again, they're still addressing these immediate needs that we saw last year. So we have a mental health priority that's now part of the strategy that was not part of it last year, only through COVID funding. So we saw the need to add mental health in a big way. So we're addressing depression, we're addressing anxiety, which is the #1 diagnosis of mental health in the country. And we're also addressing suicide because the number three cause of death among adolescents in New Jersey is now suicide. So we have pivoted some of our funding strategy to continue investing in those programs coming off of 2020. And, we also, I think our team really understands and we want to learn more the challenges of nonprofits. We understand a lot of the challenges that you face every day just running your organization. So I think that really, there was a big light last year put on that. And many of you, if not all of you in the groups around the state, did an amazing job just to keep things together, still serve your clients, keep people on the payroll, and continue to operate. So a big, thank you to everyone in the nonprofit sector for doing an amazing job last year. And we're here to just learn more from you and to help you in any way we can.
That's great, thanks. Do you see any other challenges? I think you covered some of it, but are there any specific challenges that you see, from running the foundation as you're heading into 2021?
So we would like to be a much larger financially, we're limited in terms of what we can do. So that's a challenge for us. We want to invest our resources to have the most impact. We also understand that New Jersey is a small state. However, there's lots of pockets in the state that have tremendous need, and we want to again learn more about those areas of the state and where we could perhaps have a relationship with an organization to address things like mental health, to address food insecurity. And food insecurity is going to be a major issue moving forward this year. And it's really not about food. It's really about lack of access to food, whether that's transportation or really the financial piece of it. So I think that we certainly have a big hill to climb this year. We all kind of came out of last year a little bit with a different perspective. So again, this is a learning curve for all of us, including our team, as we head into 2021.
So you talked a little bit about the challenges that you see, but whenever there's challenges, I think we've all been through a lot over the last year, and there's a lot of opportunities as well. So, do you see any kind of opportunities as you head into 2021 that you want to go over as a result of what we've all been through?
Yeah, I think it all starts with communication and talking to the various organizations and seeing how we can match up, our strategy. I think communication is a big part of it. For our group, it's an area of emphasis every single day. Sharing information with organizations. I talked a little bit about that earlier, but I don't want to paint a bleak picture. We're going to get through this. It's been difficult for everyone, including my personal family and my extended family. So I think we're going to be stronger coming out of this. I think we're going to be better equipped as we move forward because of COVID. And there's going to be new opportunities and new areas that we can blaze in terms of our philanthropy and supporting New Jersey communities. And things that we haven't thought about coming out of last year are going to be new this year. Technology, obviously, artificial intelligence, some of these other things that can help us in the field, they're all coming. And I think those are opportunities as we move forward.
That's great. So I'm not seeing any of the questions coming up in the Q&A. So I will give everybody a couple more minutes. If you have any questions, pop them in. And why we're looking for those, if you want to run the last poll, Colleen, and we'll go ahead and get that taken care of. So as we were talking about, going into 21, our last poll is in anticipation of further challenges in 2021. Are you planning to host your events virtually throughout the coming year? Seeking new relationships through Zoom meetings and introductions from friends of the organization? Developing strategic alliances with nonprofits that align with your mission? Developing partnerships with corporate companies that have similar values? All of the above or none of the above? So let's see. There's answers are still coming in. If I was guessing, I'm going with all of the above on this one, but we'll see if I'm right on this. So, oh, I've got the results popping up. So it looks like so far they're still coming in, but we're at about 72% of all of the above. So it looks like in 2021, everybody is, doing the famous pivot to try to come up with different ways of doing things, and really utilizing technology for that. All right, so I think we can go ahead and close that. And with that, I don't see any other questions popping up in the chat. So I don't know if you have any last thoughts.
There is one more question.
Oh, there is?
Yes, it just showed up in the chat. And it said, are you taking applications for new grants?
Yes, our system, if you go to community.horizonblue.com or just Google Horizon Foundation, the application system is open. The arts pillar, our creating pillar, that's by invitation only. That's a really small piece of our portfolio. So at this time, we're not inviting any new projects in for the arts pillar, but our connecting pillar, which is social determinants work, and our caring pillar, which is our obesity, diabetes work, our opioid, and our mental health work. Those are open. Any organization can apply to us. So it's available.
Great, thank you. Well, with that, I don't see any other questions unless I missed something, Colleen, in the chat again, but.
Nope.
All right. So I do just want to thank everybody for attending. We do appreciate it, especially Jonathan. I want to thank you for taking time out of your busy schedule to join us today, even though Sally may have twisted your arm.
No, just kidding. I'll do anything for Sally. She knows that. So this was a great opportunity, and I appreciate you guys having me on and being part of your webinar series. So thank you very much. Very, very terrific. Very happy to be part of it.
Well, thank you very much, and just everybody, check the website and watch your email for the next one. And thank you again.
Great. Thank you, guys. Thank you. Enjoy the rest of your day.